Hello everyone, I'm Dr. Anupama. I'm a vitreoretina surgeon working at Narayan Netralaya. Today I'm going to talk about something quite different. It's something that has taken on the fancy of the world now, where we've shifted our focus from treatment more to lifestyle modification and other modifiable risk factors. So here we're going to talk about diets. Now, we've all noticed that the low carbohydrate diet has become quite popular in recent times. This is considered quite similar to what was popular previously, like the ketogenic diet, the keto diet, so to speak, as well as the Atkins diet. Now, there are some core differences between the keto diet and the current low carbohydrate diet that has been followed, and we'll talk about a few of these. So, to start with, what is keto? Keto is basically a diet where the body's focus is shifted from using carbohydrates as your core burning fuel to fats as your core burning fuel, to such an extent that your diet is predominantly shifted from a carb-based diet to an entirely fat-based diet, where 60 to 70% of your calorie intake is shifted to fats. Carbohydrates are reduced to a minuscule 5 to 10% of this, and the remainder is compensated by proteins. This diet is very high in fat, extremely low in carbohydrates, and moderate or lower than moderate in proteins. Now, this diet did face a lot of flack over the years for various renal issues and things like that, and now has been tweaked more to a low carbohydrate sustainable model, which is the low carb healthy fat diet. Now, the low carb diet allows for a little more leeway as far as the carbs are concerned. So the low carb healthy fat diet is a little bit of a modification of the keto diet. Here, our carbs are increased to about 15 to even 30%. We try to keep it as low as 20% as far as possible, especially with diabetics, and even a little bit lower if possible. But there is that huge gap that we're allowing. The proteins are also increased up to 15 to 30%, and the remainder, of course, is compensated by the fats. Here also, the aim is to shift our calorie burning from carbohydrates predominantly to carbohydrates as well as fats. Here also, the ketone production is increased like it is in the keto diet. However, it's in the lower range of 0.1 to 0.2. Now, this diet is considered more sustainable because it is more in keeping with our normal consumption of food. It is also beneficial to diabetics and helps in weight loss as well. It comes with fewer side effects also. In addition, with the low carb healthy fat diet, we also encourage the use of plant-based fats, which are considered healthier than animal-based fats in the long run. So all of these factors make the low carb healthy fat diet a very easy and a buildable kind of a diet that we can easily incorporate into our lifestyle compared to the keto diet. If you want more information regarding diets, do consult your physician before you make any kind of switch, and a close monitoring by your physician is also required. So do keep this in mind. I hope this answers a few of your questions.